So now that we talked about screening in the general population that are healthy and asymptomatic and do not have a family history of colorectal cancer, what are the current guideline recommendations for those who have a family history of colorectal cancer? So if you have a first-degree relative, that is your father, your mother, brother or sister, if they have if any of those family members have a family or have a personal history of colorectal cancer, then you should start at age 40 or 10 years before the affected relative, whichever is earlier. For example, if your father was diagnosed at age 45 with colorectal cancer, then you should actually get colorectal cancer screening at age 35 rather than 40, given that 35 is the earlier age compared to 40. Now, in terms of screening modalities to screen for colorectal cancer, because you're at a higher risk for developing colorectal cancer, we often recommend that any individual with a first-degree relative with colorectal cancer, that they should get a colonoscopy every 5 years or 10 years. And that really depends on what age your first-degree relative was diagnosed with colorectal cancer. If your first-degree relative was diagnosed at 60 or above, then you should get your colonoscopy every 10 years. Now, if your first-degree relative was diagnosed at less than 60 years of age, then you should get your colonoscopy every 5 years.